Imagine this for a moment. You're outside, the sun is shining, and there's a gentle breeze in the air. Everything feels perfect. Sarah, like many of us, decides to treat herself to her favorite vanilla ice cream. The creamy texture and sweet flavor are just what she needs to make her afternoon special. She takes a big, satisfying bite, then out of nowhere, a sharp, stabbing pain shoots through her tooth, making her flinch. Instantly, the joy of her treat vanishes, replaced by a jolt of discomfort that lingers. The moment is ruined, and Sarah can't help but feel disappointed. If this sounds familiar, you're not alone. Tooth sensitivity is a common problem that affects people of all ages, not just Sarah. It can strike when you least expect it. Whether you're sipping a steaming cup of coffee, enjoying a cold dessert, or even just breathing in chilly air on a winter morning. That sudden, sharp pain is your body's way of warning you that something isn't quite right with your teeth. Tooth sensitivity, also known as dentin hypersensitivity, can turn simple pleasures, like eating your favorite foods, into moments of anxiety and hesitation. You might even start avoiding the foods and drinks you love, worried about when the next painful twinge will strike and ruin your day. But here's the good news. Understanding what causes tooth sensitivity is the first step toward finding real relief and getting back to enjoying life. In this guide, we'll break down exactly what tooth sensitivity is, explore the reasons behind it, and show you practical steps you can take to manage and prevent it. We'll look at the most common triggers, from hot and cold foods to certain habits, and offer solutions you can start using right away. From the way you brush your teeth to the foods you choose, small changes can make a big difference in your comfort and dental health. You'll discover how to manage sensitivity, protect your teeth, and keep your smile bright and healthy for years to come. So let's begin this journey together and help you return to pain-free eating and drinking, so you can savor every moment, just like Sarah hopes to do. Have you ever felt a sudden sharp pain in your teeth when sipping an ice-cold drink or biting into something sweet? That quick jolt is what we call tooth sensitivity, and it's more common than you might think. But what's really happening inside your tooth when you feel that uncomfortable zing? Your teeth are made up of several layers. The outermost layer is the enamel, which is the hardest substance in your body and acts as a protective shield. Just beneath the enamel lies the dentin, a softer yellowish tissue that's filled with thousands of microscopic tubules, or tiny channels. These tubules in the dentin lead directly to the nerve center, or pulp, of your tooth. When the enamel gets worn down from brushing too hard, acidic foods, or natural wear and tear, or when your gums recede and expose the root, the dentin becomes exposed to the outside world. Now, everyday triggers like cold air, hot drinks, sweet or acidic foods, or even just brushing your teeth can travel through those open tubules and reach the nerve. This sends a quick, sharp pain signal to your brain. Tooth sensitivity is usually a sudden, intense pain that fades as soon as the trigger is gone, unlike other types of dental pain. It's important to know that tooth sensitivity isn't the same as a constant, throbbing toothache you might get from a cavity or infection. Think of sensitivity as your tooth's way of sounding a quick alarm, uncomfortable, but very specific to certain triggers. Understanding how tooth sensitivity works can help you and your dentist choose the best way to treat it. The main goal is to protect that exposed dentin and calm the nerve inside your tooth, whether that's with special toothpaste, fluoride treatments, or changes in your daily habits. Next, let's explore what causes this exposure in the first place, and how you can prevent it. Remember, knowledge is your first line of defense against tooth sensitivity. The main culprit behind sensitive teeth, it's usually worn down enamel, the hard outer layer that protects your teeth. When this protective barrier gets thinner or damaged, the sensitive inner part of your tooth, called dentin, becomes exposed. This exposure makes your teeth much more vulnerable to pain and discomfort, especially when you eat or drink something hot, cold, sweet, or acidic. Acidic foods and drinks like citrus, soda, and wine slowly erode enamel, exposing dentin. Over time, even healthy foods like tomatoes or oranges can contribute to this process if consumed frequently. The acids soften the enamel, making it easier for it to wear away. Brushing too hard or using a hard bristled toothbrush can also wear away enamel and damage gums. Many people think brushing harder means cleaner teeth, but it actually increases the risk of sensitivity by stripping away that protective layer and irritating the gum line. Gum disease is another major factor. It causes gums to recede, exposing the softer root surface, which is easily worn down. The roots of your teeth don't have the same tough enamel, so they're much more sensitive to temperature changes and touch. Cracked or chipped teeth, and even tooth grinding, also known as Bruxism, can expose dentin too. Tiny fractures or chips can create pathways for sensations to reach the nerves inside your teeth, leading to sharp pain. Some dental treatments, like whitening or fillings, may cause temporary sensitivity. This usually fades after a short time, but it's important to let your dentist know if it persists. Identifying your specific cause is crucial for effective treatment. Everyone's teeth are different, and what triggers sensitivity for one person might not affect another. Protecting enamel and gums is the best way to prevent sensitivity. Use a soft, bristled toothbrush, avoid overly acidic foods, and practice gentle brushing techniques. If you notice pain, think about your habits, diet, brushing, and dental care. Sometimes, small changes in your routine can make a big difference in your comfort. Your dentist can help pinpoint the cause. They may recommend special toothpaste, treatments, or changes to your oral care routine to help manage sensitivity. The sooner you act, the easier it is to fix. Early intervention can prevent more serious dental problems down the road. Don't ignore the warning signs. Sensitive teeth are your body's way of telling you something needs attention. Let's see why certain foods and temperatures hurt so much, and what you can do to find relief. Tooth sensitivity is triggered by cold, hot, sweet, or acidic foods and drinks. Cold causes fluid in the dentin tubules to contract, zapping the nerve with pain. Heat makes the fluid expand, also irritating the nerve. Sugary and acidic foods draw fluid out of the tubules, triggering pain and further eroding enamel. Even brushing or touching exposed dentin can set off discomfort. These triggers all disturb the nerve inside your tooth. Knowing your triggers helps you avoid pain while you work on a solution. Next, let's see how your dentist figures out what's going on. Your dentist acts like a detective when you report sensitivity. They'll ask about your symptoms, triggers, and dental history. A careful exam checks for cavities, cracks, gum recession, and worn enamel. They may use a puff of air or cold water to pinpoint sensitive spots. X-rays help reveal hidden issues like deep cracks or bone loss. All this information helps your dentist diagnose the real cause. Accurate diagnosis means targeted treatment. Now let's talk about preventing sensitivity before it starts. Prevention starts with protecting enamel and gums. Brush gently with a soft, bristled toothbrush and fluoride toothpaste. Avoid harsh scrubbing. Think gentle polishing, not scrubbing. Limit acidic foods and drinks. Use a straw and rinse with water after consuming them. Wait 30 minutes after acidic foods before brushing. If you grind your teeth, ask your dentist about a night guard. Regular dental checkups catch problems early. Good daily habits are your best defense. Small changes make a big difference. Let's look at how to manage sensitivity if you already have it. Already have sensitive teeth? There's help. Switch to a desensitizing toothpaste. Ingredients like potassium nitrate or stannous fluoride can block pain. Use it consistently for best results. Relief may take a few weeks. Avoid extreme temperatures in food and drink. Maintain gentle, thorough oral hygiene to prevent plaque buildup. Floss daily to keep gums healthy. Try an alcohol-free fluoride mouthwash for extra protection. Identify and avoid your personal triggers. These simple steps can make a big difference. If pain persists, it's time for professional help. If home care isn't enough, your dentist has solutions. Fluoride varnish can strengthen enamel and block tubules, providing quick relief. Dental bonding covers exposed roots with a protective resin. Severe gum recession may require a gum graft to cover sensitive areas. In rare extreme cases, a root canal removes the nerve, ending pain for good. These treatments target the source of sensitivity. Your dentist will recommend the best option for your situation. Professional care can restore comfort and confidence. Let's wrap up with how to keep your teeth healthy for life. Don't ignore tooth sensitivity. It's your body's warning sign. Early action prevents bigger problems like cavities or gum disease. Build a strong relationship with your dental team and get regular checkups. Daily habits, gentle brushing, flossing, and a mindful diet are your foundation. These steps protect against sensitivity and other dental issues. Oral health is vital for your overall well-being. With knowledge and care, you can enjoy life's simple pleasures pain-free. A healthy, happy smile is within your reach.